Welcome again, viewers, to Remote Reflections, Dermatologists in Action. And it's my pleasure to speak to Lisa Flegel today. And Lisa, please let us know, where do you practice and how long have you been in your community?
Yeah, so I'm up in Prince George in BC, which is in central northern BC. It's a city of about 80,000 people, and we're the tertiary care center for Northern Health. So we serve about 300,000 people. We cover the entire northern half of the province. And I graduated from UBC, University of British Columbia, dermatology in 2022. So I'm now in my third year of practice, but I am just coming back to work after a 6 month maternity leave. So a little bit of a break in there.
Awesome. So tell us, what factors led you to practice in your community instead of a different setting?
So the main factor was really family connections for both me and my husband. I didn't grow up in Prince George, but I did live here for a while before attending medical school. And I actually went to medical school in Prince George. And so that was another factor. I'd already lived here. I knew I liked the community. I was familiar with the medical community, and I knew that it was a place that I would enjoy practicing. And then to a lesser degree, but also played into our decision. I loved living in Vancouver for residency. It's a great city, but it's obviously quite expensive. And so a city like Prince George that's smaller, it does have a lower cost of living. So that's pretty nice, especially when you're starting out in practice, that, housing and things are just a little bit more affordable outside of the bigger centers.
Yeah, it takes the sting out, that's for sure.
A little bit, yes.
So describe to us, what is unique in your view about working in your community compared to an urban center, and how do these unique aspects influence patient care for you?
Yeah, so I mean, across Canada, there's a shortage of dermatologists, but our region is, particularly underserviced. There's only two of us, board certified dermatologists for our whole health authority. And prior to us coming here, myself and Dr. Roberts is the other dermatologist we started together 3 years ago. There wasn't any dermatologists for the prior 10 years. And so we were basically kind of starting from scratch, which I think was a bit more difficult than if you were to set up a clinic in an urban center where there's established dermatologists. And so when we started, very quickly, we had an influx of referrals, and a large portion of the consults were and still are fairly complex cases just because the access to dermatology isn't the same. And I certainly felt when I first started that just the portion of complicated cases was so much higher than I was used to seeing in residency. Now that we're established here and have been practicing for a while, there is some more of that bread and butter that we see as well. Um, so that's one thing. And then I think the geography of where we're at is also different. So a lot of my patients aren't from Prince George, and they have to travel, 6, 8 hour drives. There's no direct flights to get here. And so because they're coming all this way, I really try my best to address anything that needs an in-person assessment in that one visit. It's really not easy to, get them to come back in a week to do a biopsy. And again, relating to it being underserviced, sometimes there's patients that need 4, 5, 6 biopsies in that visit. So that's something I noticed that was different from my training. And then I guess also Prince George doesn't have as many specialties as maybe some other similar size centers do that aren't quite as remote. So we don't have as easy of access to things like rheumatology or pediatrics or things like that would also be a difference.
Yeah, so true. Well, on the flip side, what are the more rewarding aspects to practicing dermatology in a more rural area?
Oh, definitely my patients. So I just have found that they're really appreciative of being able to receive care in their community, or, if they're not from Prince George, at least somewhere that's closer to home. And, a lot of my patients, they happily drive 8 hours to see me. And then everybody, I joke, they hit Costco on their way out of town and they make a trip out of it. So I found that, yeah, the patients are great. And then also the medical community, because we're smaller, been a really supportive and welcoming medical community. They do a good job of sort of staff engagement. Several times a year, we'll have sort of community events for physicians and their families to get to know each other. And it's been really nice to be a part of that.
No, I love that. I love that piece. It seems to be deteriorating in some communities for sure. So that's nice to hear.
Mm.
You talked about some of the unique challenges of having specialty access and having longer appointments because of the degree of travel that patients endure coming to you. But are there any other unique challenges that you would face working in a community like yours?
One of the lack of access that I find particularly difficult is Mohs micrographic surgery. So we have a fairly high burden of skin cancer, especially non-melanoma skin cancer. And, you know, it's not that our wait time is different from an urban center, but I'll often, recommend to patients, I would prefer to refer you for Mohs surgery. And it just, for financial reasons or mobility reasons, in elderly patients, they physically can't go to the urban, like to Vancouver or Edmonton, wherever it is, for Mohs surgery. So then we end up, we have great plastic surgeons here and I utilize them, but that was different than, training in Vancouver, or even I imagine, Victoria, you could take the ferry over.
Mhm.
Um, so that's been something I have much lower proportion of patients that end up getting Mohs surgery.
What's the
Um,
travel time from your community to Vancouver? How
if you were to drive, it would be 10 to 12 hours,
oh,
depending on
okay.
how much you stop. Yeah. And
Yeah.
then it's about 8.5 hours to get to Edmonton.
Okay. Pretty
Yeah.
similar. Hmm.
Yeah. And then the other challenge that I recently came across is, I think because, again, we're a little bit more remote, we're not close to the lower mainland, is, I couldn't find a locum when I was taking maternity leave. And I wonder, maybe if I was somewhere Kelowna or Kamloops that was a little bit closer to the lower mainland, it might have been easier potentially, but that's something I have become aware of now as
Right.
well.
Lack of backup. Yeah, of course.
Mhm.
Yeah. Well, so as part of your complex care management, like what helps you manage very difficult cases? What are your resources? How do you deal with complex dermatology problems?
So support from colleagues, really. I'm very lucky to have mentors from residency that I can call or reach out to when I have complicated cases and draw on their experience. And then I also regularly keep in touch and chat with my, fellow residents that I trained with. And there's a group of us that are sort of practicing outside the lower mainland in the interior that get together and chat about cases as well. And then the nice thing as part of UBC's dermatology residency, we have the grand rounds that happen once a week. And so they've now included virtual cases for those. So I've been able to present some complicated cases there. And my patients just, I send in photos and then the patient gets interviewed over the phone. So that has been nice as well. And then we don't have obviously the same specialty clinics here, like there's the DART rheumatology derm clinic or the contact dermatitis clinic. So nice for my patients that when I've referred them to these clinics, they actually have been able to be seen virtually as well, which
Hmm,
helps out too.
that's really
Not for
flexible.
patch testing, obviously, but for the initial consult, they've been accommodating to see some of our patients virtually to limit the amount of visits they have to make down.
Yes, that makes a huge difference post-COVID. Now we have these options. I really
Mhm.
I appreciate that as well. Do you think there are supports that could be better developed or are just generally lacking? Any thoughts there?
I'm not, maybe it's just I haven't been in practice long enough to know what, or because I've only practiced here, know what supports are missing that I could be accessing in a more urban center. I think the things that stand out for me are really some of the other specialist support, like the lack of access to Mohs surgery, which is not an easily fixed problem. There's probably never going to be a center here in Prince George, but even there's only one rheumatologist in Prince George. There's only a couple plastic surgeons. All the wait times are long. So
Mhm.
it's not unique to dermatology. I think we just need to recruit more physicians in general to underserviced areas.
And it sounds like the relationships you did forge in residency and in British Columbia are actually really important to have
Mm-hmm.
developed and maintained as well,
Yes.
having stayed in the area. Yeah, I love that. So, when taking a more of a bird's eye view, what incentives would do you think would encourage more specialists to choose rural opportunities?
So for me, personal connections were the most important factor. So I think having, family or at least some connection to the community is probably the most important factor in determining whether you're going to establish a practice and then stay in that community. But I think any opportunity that you can get for exposure to a rural or underserviced area is helpful. So maybe not that you might move there and practice, but even, for example, doing outreach clinics. So if there's a way to get more residents sort of outside of the urban centers to do some rotations or even a few kind of visiting clinics, I think that would be helpful as well.
Just to get the exposure, they get a sense of
Yeah,
what could be done there.
a
Yeah.
taste.
A taste. I love that. I love that. Well, I mean, you mentioned family as a good reason for you being there, but apart from that, what else do you love about living in a smaller and more rural community? How does that really enhance your personal life?
So Prince George is just, it's really easy to live here. Everything is really, it's a smaller city. Everything is really close. Like nothing really takes me more than 15 or 20 minutes to drive there. And it has all of the amenities, the things that you sort of need. Um, and so because it's really easy to access, extracurricular stuff, whether it's, getting outdoors or sports, or we have some really good recreation facilities, the fact that it's easy to do so and I don't spend a ton of my time commuting, I think it's more likely that I do things outside of work. So I feel like that has really helped my work life balance, that it's easy for me to sort of, keep work at work. And then when I'm done, it's a quick drive home. Maybe I stop and get groceries on the way home. And then, yeah, you're kind of free to enjoy the rest of your time.
Yeah, I love that. I love the short commutes in smaller towns. That's
Yeah.
a huge difference from the city, that's for sure.
Yeah.
So, what advice would you give dermatology residents or new graduates who are considering setting up a practice in a more rural community? What advice would you give?
You're considering it, to maybe, reach out and visit the community before you intend to go there and to start building some connections, because that was really helpful for me to have some connections from medical school. And then I visited Prince George mostly because of family a few times throughout residency, and was sort of able to talk to some physicians and keep an eye out on, what sort of medical space would I be able to get for leasing and that sort of thing. And then just being able to ask colleagues for help. I would also, if you're thinking about it, maybe contact the health authority and ask about financial incentives, because a lot of more rural places have like recruitment bonuses or different retention payments to, if you continue to practice in that community, and that can also be helpful if you're starting out. And sometimes, you know, if there's space, they may have the ability for you to practice in the hospital or sort of help you get set up so you don't have to do everything on your own.
Mhm.
And then I
Oh,
think
that's a lot.
the other thing would just be to, if you do end up practicing in a smaller community, to try and stay connected to the dermatologists, that you trained with, that were in your residency program. I haven't really attended any conferences since I've been up here, but I have tried to go to some of our Derm Society meetings in person once a year, just so that I can, stay a bit connected, not just always attending things virtually. I think that's important as well.
Nice. I love that. So, from the more national perspective, how can the CDA, do you think, possibly better support rural dermatologists in Canada?
Yeah, I mean, I just mentioned I haven't gone to any conferences, but I would really like to. It's kind of on my to-do list. But I think,
Calgary.
yeah, I don't, having trained in BC, I don't really know many dermatologists outside of our BC network. So maybe if there was a forum for a way for sort of rural dermatologists across Canada to connect, like, I don't know, a luncheon at one of our meetings, or if there was some sort of online platform. I mean, I would love to talk to, people in Saskatchewan that are in a similar size city, or Ontario. I don't know who those people are myself.
Again, the connections and relationships, it does really enhance our work, doesn't it? Yeah.
Yeah, it's
I
great to
love that.
have someone else to, bounce ideas off of and see, well, what's worked for them, what hasn't worked for them.
Exactly. Wonderful. Well, Lisa, thank you so much for your time today. I really appreciate learning about your experiences, getting a snapshot of your practice and your community. I'm hoping this information will be interesting to the larger community and can just help us better support rural dermatology in Canada. So thank you so much for your time.
Yeah, thank you. I was happy to join.